when I walk into a hospital, in my mind, I'm expecting to be treated like everyone else, with integrity, with respect, because I'm dealing with professionals, where I believe these doctors and nurses, they make an oath to treat everybody equally with respect and dignity. And I have to say that that's not what I've experienced. So for that reason is why I'm always hesitating about going to an emergency room. Even though they're in the medical setting, not everyone is educated enough about transgender people. Simply because I felt like I was part of a freak show. A person will come and speak to me, and I guess my voice gives me away, and they will figure out that I'm a transgender person, and I will see that person whisper something to another person, and next thing you know, I got multiple people looking at me, people laughing. There was a situation where I had surgery, and I was put in a recovery room with someone from the opposite gender. And as I was speaking with a nurse, I didn't realize that a curtain was what was dividing us two. And I was discussing my experience of my transitioning from male to female. The person on the other side, the other patient, heard what I shared with the nurse, and when he started having visitors, he started sharing my life, what he heard with his visitors. And because my curtains were half open, people started taking turns in looking into my space just to see who this person is. And to me, I found it to be disturbing. They were invading my privacy, and after the second person, they decided to come and take a look at me to see who's this person that this other patient is talking about. I asked the nurse, can she close my curtain? And one of his visitors heard that and made a derogatory comment, which I shared with my primary doctor. My going in, my main concern were the other patients. I didn't think I had to worry also about the conduct of nurses and doctors. And I had to worry about both. And after a few days, I did sign myself out. I would say that it's very dangerous for people outing you, either by, again, not asking questions and asking questions either too loudly where others can hear, because it can put you in a dangerous situation. And I hate to use the word outing, but that's pretty much what happens. And you leaving the establishment, someone that now knows your truth could feel a certain way about our community. And again, we could be put in a dangerous situation, which I've experienced. I've also had experience where I had not had the chance to change my name on my health insurance. And in front of people in a waiting room, when it was time for them to call me, they will call me by my board name, the name of the insurance. And here you got a girl standing up to a boy's name. So it's very uncomfortable. It was very embarrassing. What's very sad? I've met a lot of girls, including myself, or people from the LGBT community, not just transgender females, but people from, like I said, I keep using the phrase LGBTQ community, that have had bad experiences. And it's sad to say, but a lot of them that I've met throughout my lifetime have done self-harming, such as cutting. Me, myself, when I've had my bad experiences, I turn to alcohol. And I know some others turn to drugs. My experience this second time around was very positive. It was really different. It was really good. If I came in contact with, I would say about 10 medical staff, I would have to say that each and every one of them were very respectful. They were open to hear about my needs and just simply asking me how I was doing, why I was there, what exactly I was there for. It was something different for me. So I felt like a human being. I felt like a person, you know? Somebody actually cared. And it was a feeling that I didn't get from other places, other medical establishments that I've been to. You know, things that simple can make such a big difference. The first thing that I look at when I'm walking into a new establishment, a new location, is the amount of people that are within the place where I'm gonna be at. I also look at the demeanor, the behavior of the staff that I have to come in contact with. And depending on the behavior of those people, also, and I hate to say this because I'm not judging, also the location, the neighborhood, that also plays a big part, whether or not I'm gonna feel comfortable or safe enough to walk in that area or in that neighborhood, and which is the reason why for me I tend to make all my appointments in the morning hours, simply to avoid as many people as possible. Walking into a place and seeing anything, any kind of sign that makes me know and understand that there are LGBT friendly goes a long way. It will definitely make me feel at home. It will make me feel that I am gonna get the same treatment that most people that are not part of the LGBTQ community gets. So yes, signs and the color of our flag, that all will tell me this is an LGBT friendly establishment. Because a lot of us, including myself, I have a hard time sometimes when I have to go to a new location where I'm gonna come in contact with new people. All I'm thinking on my way there is, how am I going to be treated? For these medical students, from my perspective, I would say for them to honor their oath, their commitment in treating everyone equally, to educate themselves, even if it's just a little bit, about not so much just the LGBT community, but transgender. And if a medical student was to make a mistake in using the wrong pronoun and he or she corrects themselves immediately, again, it makes all the difference because it shows that they are trying. It's something new for them. So again, we, the people from my community, we have to understand that it's not always malicious and it's not always coming from a bad place. It's just a matter of a person having to learn and get used to being around people from the LGBTQ community. That's simple. I would advise them simply to ask questions like, what pronoun should I use? So yes, please ask. I'm sure that my community will be more than happy to educate and teach how we would like to be treated, which is very simple, with respect.